LEDs and gentleman linen. Ever felt a tingling or burning in your hands or feet and brushed it off as nothing? What if I told you that tiny invisible signals from your body could be warning you about a serious vitamin deficiency, and ignoring them could cost your nerves forever? Imagine waking up one morning with a strange tingling sensation in your hands or feet. Perhaps it starts as a minor annoyance, a slight numbness when you touch something cold, or a subtle burning that creeps along your legs at night. At first you dismiss it thinking it's just fatigue, or maybe that you've been standing too long. But over time, that tingling intensifies, the burning becomes sharper, and sometimes your nerves scream in ways that you can no longer ignore. What if I told you that this isn't just random? What if these sensations, these persistent reminders from your body are actually signals that something crucial is missing? A vital nutrient that your nerves desperately need. Your nervous system is the command center of your entire body. Every thought, every movement, every sensation relies on it. When it functions at its best, life flows seamlessly. You reach for a glass of water and your hand moves with precision. You feel the texture of a fabric and experience it fully. You walk through your day with coordination and balance. But the moment something disrupts this delicate network, your life starts to feel out of sync. Tingling, burning, and nerve pain aren't just random irritations. They are your body waving red flags, telling you that it is not receiving the nutrients it needs to thrive. And one of the most common culprits, surprisingly, is a vitamin your body can't live without: vitamin B12. Vitamin B12 is more than just a vitamin. It is a lifeline for your nerves. Without it, the protective sheaths around your nerves begin to deteriorate, much like insulation wearing thin on an old electrical wire. That insulation, called the myelin sheath, allows nerves to send messages quickly and efficiently. When it weakens, signals misfire, causing sensations that can range from mild tingling to excruciating burning pain. People often ignore these early signs, thinking they are minor annoyances, but over time, untreated deficiencies can lead to numbness, difficulty walking, memory issues, and even irreversible nerve damage. Many individuals don't realize how easy it is to become deficient in this crucial nutrient. Our diets today are often lacking in adequate B12, especially for those who follow plant-based diets, have digestive conditions, or take medications that interfere with absorption. Even if you consume foods rich in B12, like meat, eggs, and dairy, absorption can be hindered by factors like low stomach acid or certain autoimmune conditions. Your body may be starving for this essential vitamin, even if your meals seem sufficient. The first step toward change is awareness. Notice the subtle signs your body sends: prickling in the fingers or toes, a sensation of walking on pins and needles, unexplained fatigue or difficulty concentrating. These are not isolated symptoms. They are whispers of warning. Pay attention to them. Do not push them aside or wait for them to escalate into severe nerve pain that disrupts your life. Awareness is the first form of empowerment. Next, take proactive steps to restore what your body lacks. B12 supplementation is not just a recommendation, it's a strategy for healing. Depending on your situation, supplementation can come in the form of oral tablets, sublingual drops, or even injections. Each method delivers this life-saving nutrient in a way your body can use effectively. Imagine your nervous system finally receiving the nourishment it has been craving for months, or even years. Tingling starts to fade, burning diminishes, and your movements regain their smooth, effortless flow. But addressing vitamin deficiency is only part of the solution. Your lifestyle matters. Adequate sleep, balanced nutrition, regular movement, and stress management all play roles in nerve health. Chronic stress, poor diet, and lack of exercise can exacerbate nerve pain and reduce the effectiveness of supplements. Think of your body as a delicate ecosystem. Every choice you make either supports its balance or throws it further off. Consistent, mindful habits amplify the healing effects of proper supplementation. Many people also underestimate the power of early intervention. Nerve pain and tingling often start subtly and are easily ignored. By the time the pain becomes severe, the damage may be harder to reverse. Acting quickly, consulting with healthcare professionals, and incorporating the necessary nutrients into your routine can prevent long-term complications. Every day you wait without addressing the root cause is a day your nerves are under unnecessary stress. It's also important to remember that healing is a process, not an instant fix. Nerve recovery takes time because your body needs to rebuild the protective myelin sheath and restore proper signal transmission. Patience is critical, but so is consistency. Take your supplements as advised, maintain a nutrient-rich diet, and observe your progress over weeks and months. Celebrate the small improvements: a decrease in tingling, less frequent burning, regained sensation in fingers or toes. Each of these is proof that your body is healing and responding to the care you're giving it. Beyond the physical, there is a mental and emotional aspect to nerve pain. Living with persistent tingling, burning, or numbness can erode confidence, limit activity, and create anxiety about the future. By addressing the deficiency and taking control of your health, you not only relieve physical pain, but reclaim mental clarity and emotional well-being. You begin to trust your body again, to rely on it, and to feel empowered instead of restricted by discomfort. Imagine a life where your body communicates clearly and effectively, where sensations are accurate, reflexes are sharp, and pain does not dominate your days. This is possible when you respect the signals your body gives and respond with knowledge and action. Nerve pain is not just a random misfortune, it is a message and invitation to pay attention, to nourish, and to reclaim vitality. Every tingling finger, every burning sensation is not a punishment but a guide pointing you toward a vital correction. Finally, understand that prevention is as powerful as intervention. Once you address a deficiency and restore nerve health, maintaining optimal B12 levels is essential. Make nutrient-rich foods a regular part of your life. Stay aware of changes in your body and do not ignore even minor signs of discomfort. Early attention and consistent care can keep nerve pain at bay and prevent future complications. This journey from discomfort to relief begins with recognition, continues with action, and solidifies through consistency. By identifying a vitamin deficiency as the root cause, you unlock the potential to reverse nerve damage, restore comfort, and regain control over your body. Your nervous system, once struggling and overwhelmed, can function with precision, allowing you to move freely, think clearly, and experience life fully. Every person experiencing tingling, burning, or nerve pain has the opportunity to take charge. Your body is intelligent, capable of healing, and responsive to the nutrients it needs. The sensations that once frightened or frustrated you can become signals guiding you toward better health. Listen, act, and commit to the process of restoration, and your nerves will reward you with renewed function, comfort, and vitality. Imagine the first time you notice a strange sensation in your hands or feet. It might start subtly. A light tingling when you touch something cold, or a faint prickling as if tiny pins are brushing against your skin. At first, it feels almost insignificant, something you can ignore, something that will pass if you rest or shift your position. But the truth is, these early signals are your body's way of speaking to you. They are not random occurrences or just quirks of your nerves. They are warnings, the first whispers of something deeper. Nerve health is critical, and your body is giving you a chance to listen before things progress further. These tingling sensations, burning feelings, or numbness often begin in the extremities, the hands, fingers, feet, or toes. The reason these areas are affected first is simple. The nerves in the extremities are long and highly sensitive. They are the farthest points from the center of your body, and when a deficiency or disruption occurs, these distant parts experience the first symptoms. Many people assume that such sensations are just fatigue, stress, or the result of standing too long. But when these feelings persist, intensify, or appear alongside other symptoms, it becomes clear that something more significant is at play. Understanding why these sensations occur requires a brief look at how nerves function. Nerves are like intricate electrical wiring systems, transmitting signals from the brain and spinal cord to every part of the body. To do this effectively, they are insulated with a protective layer called the myelin sheath, which ensures rapid and precise communication. When this sheath weakens or becomes damaged due to a lack of essential nutrients, the signals misfire. What was once a smooth transmission becomes erratic, leading to tingling, numbness, or a burning sensation. These are not minor annoyances. They are your nervous system telling you that it is struggling, that it lacks the fuel necessary to maintain optimal function. Among the essential nutrients, vitamin B12 plays a particularly critical role in nerve health. This vitamin supports the maintenance of the myelin sheath and the proper function of nerve cells. A deficiency in B12 can slowly erode this protective layer, causing nerves to send faulty signals. This is why someone low in B12 might feel constant tingling, burning, or a prickling sensation, even without any obvious injury. The body relies on this nutrient to maintain its wiring, and when it is absent, the first symptoms appear in the extremities, often before other signs of deficiency, such as fatigue or cognitive issues, become noticeable. The subtlety of these early warning signs is part of what makes them so dangerous. Many people dismiss tingling or mild burning as inconsequential, attributing it to everyday stress or temporary nerve compression. Yet, ignoring these signals allows the deficiency to progress, potentially leading to permanent nerve damage. The body is giving you a chance to act before serious consequences occur. Recognizing these signs is the first step toward reclaiming control and preventing long-term issues. Awareness is empowerment, and acknowledging these symptoms can make the difference between temporary discomfort and chronic nerve impairment. Moreover, these early signals often come with other subtle symptoms that are easily overlooked. Slight changes in balance, unexpected clumsiness, or difficulty gripping objects may accompany. Tingling or burning. Some individuals notice that their hands feel weak or that their fingers are numb when typing or writing. Others might experience unexplained fatigue or brain fog, which can be linked to the same underlying deficiency affecting the nerves. Understanding the connection between these seemingly unrelated signs allows you to address the root cause rather than just treating the symptoms. It is also important to recognize that nerve issues do not discriminate based on lifestyle or age. While older adults may be more prone to vitamin deficiencies due to changes in digestion or absorption, anyone can experience nerve problems. Vegetarians and vegans, for example, may be at higher risk because B12 is primarily found in animal products, but even those who consume meat can develop a deficiency due to digestive issues, autoimmune conditions, or medications that interfere with absorption. The key is paying attention to what your body is communicating rather than assuming that certain habits or diets make you immune to these warnings. Education plays a vital role in early recognition. Knowing what to watch for and understanding the connection between nutrient deficiencies and nerve sensations equips you to take proactive steps. Symptoms like tingling, burning, or numbness are not signs of weakness. They are messages. When you see these signs, you have the opportunity to investigate it, to seek medical advice, and to make adjustments before the problem escalates. Waiting for more obvious pain or functional loss is not necessary because the body communicates early for a reason. Furthermore, awareness is not just about noticing symptoms, but about trusting your intuition. Many people feel something is off, but convince themselves it is nothing serious. Learning to trust your body's signals is essential. Each twinge, each prickling sensation, each unexplained discomfort, or it is part of a conversation between you and your nervous system. Listening carefully, tracking changes, and documenting patterns can provide valuable insight and guide your decisions regarding diet, supplementation, and lifestyle adjustments. Ultimately, the first keynote of this speech is about recognizing and honoring the warnings your body gives. Tingling, burning, and nerve pain are not random inconveniences. They are critical indicators of a deeper issue, often pointing to a nutrient deficiency that can be corrected. By paying attention, understanding the underlying mechanisms, and responding proactively, you can prevent progression, protect your nervous system, and restore normal function. Early recognition is not just an action, it is a commitment to your health, a declaration that you will not ignore the messages your body sends, and a powerful first step toward healing and long-term well-being. Once you have recognized the early warning signs of nerve distress, tingling, burning, or numbness, the next critical step is taking decisive action to restore nerve health. This begins with understanding the role of nutrition and supplementation in supporting the nervous system. Nerves, like any other part of the body, require specific nutrients to function properly, repair themselves, and maintain their protective structures. Without these essential building blocks, the nervous system struggles to communicate efficiently, and symptoms such as burning sensations, prickling, or numbness persist or worsen. Vitamin B12 is among the most crucial nutrients for nerve health. This vitamin is not just a supplement, it is a fundamental component that ensures your nerves are insulated, signals are transmitted accurately, and your body can perform complex tasks with precision. When B12 levels are low, the protective myelin sheath around your nerves deteriorates, and the transmit sign of electrical impulses becomes faulty. This leads to the familiar sensations of tingling and burning, which are often misinterpreted as minor irritations rather than clear signals of deficiency. By introducing proper supplementation, you provide the body with the raw material it needs to repair these protective sheaths, restore signal integrity, and reduce discomfort. Supplementation methods vary depending on the severity of the deficiency and individual needs. Oral tablets are convenient and effective for many people, delivering B12 directly into the digestive system. Sublingual forms taken under the tongue allow for rapid absorption into the bloodstream, bypassing digestive barriers that can interfere with uptake. In some cases, particularly when deficiencies are severe or absorption is significantly impaired, injections may be recommended to deliver a concentrated dose directly into the body. Regardless of the method, consistent supplementation replenishes the nutrients that the nervous system has been craving, allowing damaged nerves to begin the healing process. However, supplementation alone is not a complete solution. Nutrition as a whole plays a pivotal role in nerve repair and maintenance. A diet rich in whole foods, including lean proteins, leafy greens, eggs, dairy, and fortified provides not only B12 but also other essential vitamins and minerals that support nerve function. Nutrients such as vitamin B6, folate, vitamin D, and magnesium work in synergy with B12 to facilitate proper nerve signaling and repair. By nourishing your body with a variety of these essential nutrients, you create an environment in which your nervous system can thrive, reducing nerve pain and restoring balance. Lifestyle habits also amplify the effectiveness of supplementation and nutrition. Adequate sleep allows the body to repair and regenerate nerve tissue. High regular movement promotes circulation, ensuring that nutrients reach the extremities where they are needed most. Stress management is equally important because chronic stress releases hormones that can exacerbate inflammation and nerve sensitivity. A holistic approach that combines supplementation, nutrition, exercise, and stress reduction ensures that the nervous system receives comprehensive support and increases the likelihood of recovery. Consistency is key in this process. Nerve repair is not instantaneous. Depending on the severity of the deficiency and the level of nerve damage, it may take weeks or months for symptoms to noticeably improve. Tingling may gradually fade, burning sensations diminish, and coordination in the hands and feet can return. Patience is essential, but so is diligence. Patience is essential, but so is diligence. Regular intake of supplements, adherence to a nutrient-rich diet, and ongoing lifestyle adjustments work together to rebuild the myelin sheath, restore proper nerve function, and prevent future deficiencies from arising. It is also critical to work closely with healthcare professionals during this process. Blood tests and neurological assessments can help track B12 levels, monitor nerve function, and ensure that supplementation is tailored to your individual needs. A professional perspective helps identify any underlying conditions that may interfere with absorption or exacerbate nerve pain, allowing for a more targeted and effective approach. By combining professional guidance with personal commitment, you maximize your chances of regaining full nerve health. Beyond the physical restoration, there is a profound psychological benefit to taking control of your nerve health. Chronic tingling, burning, and numbness can be frustrating and emotionally draining, limiting activity and creating anxiety about the future. By actively addressing the deficiency and supporting instant of repair, you reclaim not only physical comfort, but also confidence, independence, and peace of mind. The nervous system is no longer a source of persistent stress, but a system that functions smoothly, allowing you to engage with life fully and confidently. Preventive maintenance is equally important once initial recovery begins. Establishing a long-term strategy that includes regular intake of essential nutrients, a balanced diet, adequate sleep, and consistent movement helps protect the nervous system from future deficiencies or damage. Early intervention combined with ongoing care ensures that your nerves remain resilient and responsive, reducing the likelihood of recurring pain or dysfunction. Restoring nerve health is a journey that requires awareness, commitment, and action. By understanding the critical role of vitamin B12 and other nutrients, incorporating proper supplementation, nourishing the body through diet, and adopting supportive lifestyle habits, you give your nervous system the tools it needs to heal and thrive. The burning, tingling, and numbness that once caused frustration can diminish, replaced by improved sensation, coordination, and overall vitality. Each step you take in supporting your nerves is a step toward a stronger, healthier, and more empowered body. Through consistent care and mindful choices, your nervous system can regain stability and efficiency. By addressing the root causes of deficiency, you transform what once was a source of discomfort into an opportunity for renewal and resilience. Nerve repair is not only possible, it is achievable when you commit to providing your body with the nutrition, supplementation, and lifestyle support it needs. The path to relief lies in your hands, and by taking proactive steps today, you restore not just nerve health, but your overall quality of life. Acting early and maintaining consistent. Care is one of the most powerful strategies when it comes to nerve health. The human body is incredibly resilient, but it is also delicate in the ways it communicates distress. Tingling, burning, or numbness in your hands or feet is not just a fleeting inconvenience. It is a signal that something is out of balance. The sooner you recognize these signals and take action, the greater your chance of preventing long-term damage. Early intervention can mean the difference between minor discomfort that resolves in weeks and chronic nerve damage that may become permanent. One of the most important aspects of early action is understanding that nerve issues are often progressive. A minor tingling sensation today can evolve into persistent burning or numbness over time if left unaddressed. Nerve damage doesn't occur overnight. It develops gradually, often without causing major pain at first. This gradual progression is what makes early recognition so vital. By responding at the first sign of discomfort, you give your nervous system the opportunity to repair itself before symptoms escalate and before your quality of life is affected. Consistency plays an equally crucial role. The nervous system cannot heal through sporadic attention or half-hearted measures. Supplementation, diet, and lifestyle changes must be maintained consistently to support proper nerve function. Regular intake of essential nutrients like vitamin B12 ensures that your nerves receive a steady supply of what they need to repair damaged myelin sheaths, restore proper signaling, and reduce pain. Inconsistent supplementation may slow the healing process or allow deficiencies to persist, prolonging discomfort and risking further deterioration. Lifestyle habits work hand in hand with supplementation and nutrition. Movement and exercise promote blood flow, delivering oxygen and nutrients to the extremities where nerve repair is most needed. Adequate sleep allows the body to regenerate and heal, while stress management reduces inflammatory hormones that can worsen nerve sensitivity. Chronic stress, poor sleep, and a sedentary lifestyle can undermine the benefits of supplementation, highlighting the importance of consistent holistic care. Every small choice contributes to the overall healing process, and the accumulation of these choices creates a foundation for long-term nerve health. Early intervention also includes seeking professional guidance. Blood tests, neurological evaluations, and personalized recommendations ensure that you address not just the symptoms, but the root cause of nerve distress. Some individuals may have underlying conditions that impair nutrient absorption or complicate nerve function, and professional monitoring helps tailor treatment to these specific needs. Acting early with professional support allows for adjustments in dosage, form of supplementation, or lifestyle strategies that optimize recovery and minimize risks. Preventing long-term complications is another critical benefit of early and consistent care. Nerve damage can become permanent if deficiencies or stressors are left uncorrected for too long. Early supplementation and lifestyle adjustments protect against this irreversible damage, keeping nerve function intact. Tingling and burning may seem minor, but over time, persistent deficiencies can affect balance, coordination, and even cognitive function. Acting swiftly prevents these progressive complications, giving you a greater degree of control over your health and future well-being. Consistency also reinforces a sense of empowerment and self-efficacy. Chronic nerve discomfort can create anxiety, fear, and a feeling of helplessness, especially when symptoms interfere with daily life. By committing to a routine of supplementation, proper nutrition, movement, and rest, you reclaim agency over your body. Each day of consistent care strengthens not just your nervous system, but also your confidence in your ability to respond to challenges and maintain health. You are no longer passively experiencing symptoms, you are actively reversing them. Moreover, consistent care encourages long-term prevention. Once initial nerve health is restored, maintaining good habits ensures that deficiencies do not return and that nerves remain strong and responsive. This includes incorporating B12-rich foods into your regular diet, continuing supplementation as needed, monitoring, and sustaining a lifestyle that supports overall nervous system function. Preventive strategies reduce the likelihood of recurring tingling, burning, or numbness, creating a stable foundation for enduring vitality and comfort. Patience is integral to this process. Nerve recovery is not immediate. It takes weeks or months for damaged nerve fibers to rebuild their protective layers and restore proper function. Early intervention and consistent care ensure that this process is as efficient and effective as possible. Each incremental improvement, less tingling, reduced burning, regained sensation, is a sign that your nervous system is responding positively to the care you are providing. Acknowledging these small victories helps maintain motivation and reinforces the importance of persistence. Emotional and mental well-being is deeply connected to nerve health. Persistent nerve discomfort can affect mood, focus, and daily functioning, creating a cycle where stress exacerbates symptoms and symptoms increase stress. By intervening early and caring consistently for your nerves, you break this cycle. Your body and mind begin to function more harmoniously, reducing anxiety and enhancing overall quality of life. The proactive steps you take not only heal nerves, but restore confidence, clarity, and a sense of balance. Ultimately, the lesson of early action and consistent care is simple. Your body communicates, and it is your responsibility to respond. Tingling, burning, and nerve pain are not arbitrary. They are messages that something requires attention. By acting promptly, committing to consistent supplementation, maintaining a nutrient-rich diet, adopting supportive lifestyle habits, and seeking professional guidance when needed, you prevent progression, promote healing, and protect long-term nerve health. These steps empower you to regain control, restore normal sensation, and reclaim comfort in your body, mind, and life. Early recognition combined with consistent care transforms nerve health from a reactive struggle into a proactive journey of restoration. Each step, each day of mindful action strengthens your nervous system and lays the groundwork for lasting relief and vitality. The power to change the course of nerve discomfort lies in your awareness, commitment, and consistency. In life, the body often speaks in whispers before it ever shouts. Tingling, burning, or nerve pain is not just discomfort. It is a signal, a call to awareness, and an invitation to take action. By recognizing these early signs, you open the door to understanding what your body truly needs. By restoring essential nutrients, particularly vitamin B12, through proper supplementation and a nutrient-rich diet, you provide your nervous system with the tools it requires to repair, protect, and thrive. By embracing consistent care, supportive lifestyle habits, regular movement, stress management, and patience, you allow your nerves to heal fully, reducing pain, improving sensation, and reclaiming control over your body and life. The journey from discomfort to relief begins with listening to your body, taking deliberate action, and remaining committed to the process. Healing is not an instant fix, but a deliberate and ongoing effort. Each step you take to nourish your body, support your nerves, and prioritize your well-being creates a ripple effect, improving not only physical health, but mental clarity and emotional resilience. Prevention, early intervention, and consistent care work together to ensure that your nervous system remains strong, responsive, and capable of sustaining the life you want to live. Your body is intelligent, capable of regeneration, and eager to respond when given the right support. Ultimately, the power to overcome tingling, burning, or nerve pain lies in your hands. By paying attention to the signals your body sends, addressing deficiencies, and committing to consistent mindful care, you transform what once felt like a limitation into an opportunity for restoration, strength, and vitality. Take charge of your health today, and let every small step you take toward your nervous system's well-being become a victory for your future self.